The biggest challenge that the NHS is going to face, and the people working in it are going to have to confront, is that, look, we've lived through a golden age where there has been boundless investment going into the health service. That is changing. We live in a time of fiscal constraint. This is going to be an age of austerity. NHS budgets might grow, but they're going to be growing at a far lower rate, but demand is going to continue to increase. First of all, we've got to think about the sort of services that we want to see and whether they're optimum at the moment. Most people think, for example, that with a rising burden of chronic disease, spending more and more money on hospital care is probably not the most sensible thing to do. If we can keep people out of hospital, get them treated in the community, or better still, prevent them getting ill or iller, then that is not just good for the individual and their families, but it's pretty good for the taxpayer too. I think many clinical staff at the NHS feel frustrated about the way that the NHS is organised right now. They feel that they have a level of potential that isn't always fulfilled, and they come up against bureaucracy and so on that frustrates their efforts. So take pharmacies as an example. You know, pharmacists are not shopkeepers, they're trained clinicians. And we don't fully utilise them in our healthcare system. People forget that the first port of call for patients isn't actually the GP surgery, it's the pharmacy. Now, of course, pharmacists will always have a responsibility to dispense safely and to prescribe treatments. But wouldn't it be far more sensible, since there's a relationship of trust between the individual patient and the pharmacist in local communities, that we utilise the skills of the pharmacist, say, to help the diabetic patient manage their diabetes? And I think that's where the future lies, both because it will provide more accessible, higher quality care, but it will also be more affordable. Given the challenges that we face, declining budgets, more costs coming through, an ageing population, we need to harness as much expertise in the National Health Service as we can gather, wherever that expertise comes from. In the end, look, what counts for patients is quality. What counts for taxpayers is efficiency. There should be no preferred providers, whether public sector, private sector, or third sector. Whoever can best provide the highest standards of care at the best price, they should be in a position to deliver the service to NHS patients. NHS values, NHS principles, care for free based on need, not ability to pay, they're absolutely sacrosanct. Where the care comes from should be a secondary consideration. So in future years, I think we should expect to see more, not less, cooperation between public and private sectors. In order to make the relationship work between public and private sectors, it's got to be based on a relationship of trust. And so the biggest change that we've got to see is an attitudinal change, which is that if somebody is thinking of commissioning a service in the NHS, don't have a knee-jerk view that there is one sector that is better than the other, whether that's private or public. The critical test is a very straightforward one, and it is going to become even sharper in future, which is value for money, standards of care, quality and efficiency. These two things sitting side by side. In the end, that is what counts for patients, that is what counts for taxpayers, and that is what counts, should count, when people are making important commissioning decisions, whether that is in prisons or in care homes or in primary care or in community services.